Hi everybody, my name is Dr. Niharika. I'm a fertility consultant at Kamineni Fertility Center. Today I will be speaking about the sperm DNA fragmentation index and its significance in our fertility treatments. So basically DNA fragmentation index is defined as the number of the percentage of sperms that are having DNA damage in a given semen sample. So if the DNA fragmentation index is above 15, then we consider that the semen sample is having a increased DNA fragmentation index, meaning most of the sperms are having DNA damage. So if such a sperm is fertilizing the egg, there is a decreased chances of fertilization. Also, if there is an increased risk of miscarriages, if such an sperm is giving its DNA to the embryo or the offspring, then there is an increased risk of miscarriage. So that is why we have to understand the DNA fragmentation index, and let us understand the DNA fragmentation index by first understanding what is the DNA damage or DNA fragmentation that we see in a semen sample. So the regular semen analysis that we do will not help us understand what is the DNA damage. The regular semen analysis can only tell us the number of the sperms, the number of the motility sperms, and the percentage of the sperms that are having a normal shape. So DNA is something that is present inside the head of the sperm. We know that the sperm is a very microscopic structure. So we know that the head part of the sperm has a nucleus wherein the actual DNA material is present. So why do we have to understand whether the DNA is good or DNA is bad? Because the main purpose of the sperm is to provide its DNA material to the egg and help in the fertilization process and then help in the formation of the embryo. So the DNA material from the sperm is being transmitted to the offspring. So if the sperm DNA is good, then the DNA transmission to the embryo will be good, and hence the embryo will have a stronger DNA composition, and there is an increased chances that such an embryo will have a good implantation and also result in a healthy child. So nature, something is very important that we have to understand. So by nature, God has given the DNA to not get exposed to much of the exposing factors or the damaging factors that it has to get, that will get exposed while in the genital tract. So as we know that the head structure is very small, the nucleus is even more smaller. So the DNA, normal DNA, is usually condensed to less than 10% of its volume, and therefore it is omitted from the exposure that it undergoes, and the DNA is protected from such factors which can damage it or which can cause fragmentation in the DNA or cause breaks. DNA, we know, is a deoxyribonucleic acid. Many of you would have seen that it is having a good helix structure or a ladder structure that we see. So there might be breaks in this helix structure that can result in an abnormal DNA. So an embryo that is formed from this abnormal DNA will definitely have an increased risk of miscarriage. We see many patients who are having increased incidence of biochemical pregnancies, or increased incidence of first trimester losses, or increased incidence of blighted ovum. Blighted ovum is something where the gestational sac is seen, but the fetal pole or the fetal signs are not seen in the uterus. So there is an increased risk of all these amount of abnormal pregnancies when an embryo is formed from such a damaged DNA from the sperm. So now it is of utmost importance for us to avoid such pregnancies, and also increased DNA fragmentation index in a certain semen sample is one of the reasons of unexplained infertility, or there is something called as subfertility, where most of the factors of the infertility show to be in the normal range, but still the patient is not able to conceive. So this high DNA fragmentation index we see in patients who are of the advanced age, or patients who are having unhealthy lifestyle, patients who are, if there is a history of smoking, drinking, exposure to the environmental toxins like pesticides, pollution, and ingestion of unhealthy, uncooked, or processed food, excess amount of processed food, and smoking, drinking, and all other abusive medication can increase the DNA fragmentation or cause the DNA damage in the sperms, and hence decrease the fertility capacity of such a semen sample. So basically there are 2 to 3 steps where the sperm can get damaged by the exposure of all these chemicals. So one is while the time it is being produced in the testis. So at the testis there is something called as the when the sperm is being produced, as I said, the DNA undergoes a condensation, and also the protein changes happen in the DNA from histamine to protamine. So proteins are more protective of the DNA, that is, they wouldn't allow the DNA to get any damage. So a mature sperm will have a DNA that is having 85% of the protamine proteins, which is good for the DNA to be not being damaged by the environmental toxins or the exposing factors. So underprotamination is something that is a cause why there will be an increased DNA damage. And also nature or our body itself has a defense mechanism where immature cells, immature sperms or abnormal sperms that are being produced while they are being produced, because the sperm is produced in millions. So one sperm that is being produced sometimes can be abnormal shape. So all these abnormal sperms are usually lysed by our own body, called as apoptosis, or there's something called as a programmed death. So if a sperm is not good or maturity wise it is not up to the mark, then the body itself will usually undergo cell death of these abnormal sperms. So a body itself has a natural defensive mechanism or a capacity to decrease the DNA fragmentation. So that some amount of DNA fragmentation will definitely be present in any semen sample. So we take a cutoff about 15%. So DFI a sample that has DFI 15 or less than 15 is considered to be a good fertility index semen sample. And such sperms will have a better fertilizing capacity and also have a decreased incidence of miscarriages in the mother. So that is one mechanism by which the body itself will decrease the DNA fragmentation index. But if the testicles are being exposed to the harmful chemicals or increase the incidence of reactive oxygen species, then again the sperm will have a DNA damage. So the main causes or reasons why there is an increased incidence of DNA fragmentation is, one is exposure to the chemicals that can damage the DNA, excess amount of exposure, and the increased reactive oxygen species that we see in the sperms that are being produced at the cell level. So in mitochondria there is something called as reactive oxygen species which are being produced. So if they are produced in excess amount, then they are going to damage the normal sperms or cause DNA damage by breaking the DNA strands or causing an abnormal DNA composition. So reactive oxygen species, if they are in excess amount, it is harmful to the body. We know there's something called as oxidative stress, which is a main mechanism wherein the DNA damage happens. So oxidative stress causes increase in the reactive oxygen species. Our body has a natural mechanism to cope up with the reactive oxygen species. So if there is excess reactive oxygen species and we have a good antioxidant capacity or nutrients in our body, then they will decrease the reactive oxygen species. So a balance between this antioxidants and the reactive oxygen species is of utmost importance in the body, which will help maintain a good DNA composition of the sperms. So, but because of the unhealthy lifestyle or exposure to the radiation, patients who have had history of cancer, they might have undergone radiation therapy or chemotherapy, or they might have undergone excess use of abusive drugs. So in all these patients, they tend to have an increased ratio of reactive oxygen species, which will damage the DNA. So by supplying the antioxidants or giving the patient oral antioxidant therapy or taking antioxidants naturally from the diet will help the male to decrease the DNA fragmentation. So that is one of the most important management that we do. So who are the patients in whom the DNA fragmentation index has to be tested? So when a male has undergone a basic semen analysis, if the semen analysis parameters are normal, then we have a very low probability that there might be any DNA fragmentation index in such a good semen sample. But in many cases of unexplained infertility who are having a normal semen analysis parameter, we have seen that there is increased incidence of DNA fragmentation. So a male who is about age 30, about 40 years of age, who is having any comorbidities like diabetes or hypertension, or is on any other medication, or who is having a history of smoking, drinking, then substance abuse, who has had history of any cancer, or patient who is having unexplained infertility, a patient who is having a previous IVF failure where the embryo was not formed properly, or there was very low fertilization rates. These are the situations in which we usually test or go for a DNA fragmentation index. So there are different tests that can be done, different types of modalities that assess the DNA fragmentation index. One is the tunnel assay. Then the next is the COMET, or the sperm chromatin decondensation assay, or sperm chromatin structure assay. So these different assays will help us understand the DNA fragmentation index of a particular semen sample. So then it will be helpful for our management. So whenever we see that a couple or a male is having a high DNA fragmentation index, what are the management steps that we follow? So first, we usually ask the patient we assess the patient's lifestyle, and if we find that there are any modifiable lifestyle changes that can help decrease the DNA fragmentation, we give them such a protocol so that it will be helpful to decrease the DNA fragmentation index. And also, along with the lifestyle changes, there is an diet chart that also we give the male, so that it will be helpful to decrease the DNA fragmentation index. So in diet particularly, we help the male to understand that he has to ingest foods that contain mainly vitamin A, C, E, and if the patient is comfortable having fish, then fish contains a good amount of omega-3 fatty acids, which is a good antioxidant. So foods containing these micronutrients will help to increase the will decrease the DNA fragmentation index and improve the semen fertilizing capacity. Also, apart from the micronutrient supplements in the diet, we also give them oral antioxidants that contain mainly folic acid, L-carnitine, selenium, zinc, then L-arginine, then N-acetylcysteine, coenzyme Q10. So these are few antioxidants that will help to improve the DNA fragmentation index, meaning decrease the DNA damage or increase the sperms that are having more of a good DNA content. Also, if the patient is suffering from, sometimes the oxidative stress could be because of the varicocele. Varicocele is some condition where there is increased temperature around the testicles, which will cause the oxidative stress and damage the DNA. So by doing a surgery to correct the varicocele and controlling the infections locally, if the patient is suffering from, can also decrease the DNA damage. Also, frequent ejaculations will usually decrease the amount of the DNA damage. This is because the time the sperm spends more inside and it gets more exposed to the risk factors, there is an increased incidence of DFI. So these are the few steps that few corrections that we give the patient, so that by the time we start the treatment process, there is a probability that it can lower the DNA fragmentation index. But there are also few steps that we follow in the lab or at the clinic to decrease the DNA fragmentation or decreases probability that embryo is being formed from an abnormal sperm. So one such process is that whenever we are processing the sperm in the lab, decreased centrifugation and cryopreservation, because in cryopreservation, when the sperm is being exposed to chemicals, sometimes there is a DNA damage that can happen. So decreasing these incidences and following simple selection methods like swim up technique or the density gradient method will decrease the DNA damage. And also, if the patient is undergoing a treatment of ICSI, then using the testicular sperms in a patient who is having more DNA fragmentation index in the ejaculate sample, that is around more than 40, will at least help have a better embryo formation or fertilization rates. And also, higher advanced techniques of the ART can be used, like the PICSI, physiological ICSI, or IMSI techniques can be used to select a very good sperm that has good DNA composition. So these things can be done to manage a person with a high DNA fragmentation index. Thank you. Hi everybody, my name is Dr. Niharika. I'm a fertility consultant at Kamineni Fertility Center. Today I will be speaking about the sperm DNA fragmentation index and its significance in our fertility treatments. So basically, DNA fragmentation index is defined as the number of the percentage of sperms that are having DNA damage in a given semen sample. So if the DNA fragmentation index is above 15, then we consider that the semen sample is having a increased DNA fragmentation index, meaning most of the sperms are having DNA damage. So if such a sperm is fertilizing the egg, there is a decreased chances of fertilization. Also, if there is an increased risk of miscarriages, if such an sperm is giving its DNA to the embryo or the offspring, then there is an increased risk of miscarriage. So that is why we have to understand the DNA fragmentation index, and let us understand the DNA fragmentation index by first understanding what is the DNA damage or DNA fragmentation that we see in a semen sample. So the regular semen analysis that we do will not help us understand what is the DNA damage. The regular semen analysis can only tell us the number of the sperms, the number of the motility sperms, and the